Obligate anaerobe. Obligate anaerobe is further divided into two. One is bacilli, gram-positive bacilli and gram-positive cocci. In gram-positive, further two divisions are there. One is spore-forming, that is Clostridium species, and other is non-spore-forming, that is actinomycetes, Propanibacterium acne. Actinomycetes have actinomycete Israeli is the most important, causing the 90% of infection, and sulfur granules molar teat colonies are the identification. Propanibacterium acne most frequently recover from the blood cultures as a contaminant because it is a part of a skin flora. Further in this group, Mobilinkus species are there, that is genital present in a genital area, highly motile with a long filaments about 2.9 micrometer. Another is lactobacillus. It is also found in GIT and genital and microaerophilic catalase negative. Their glucose in products is a lactic acid. Another organism in this group is a Eubacterium, bifidobacterium. It is present in the mouth and GIT and is acetylcholine positive. And the catalase negative group is actinomycete. Actinomycete is mouth normal flora. It's a microaerophilic sulfur granules are present in all the species. Actinomycete Israeli is a biologically positive, and Miri is a strict anaerobe, and viscous is catalase positive. Further, we explain that gram-negative have cocci. Gram-negative cocci in obligate anaerobes are Veillonella, and gram-positive are Bacteriology. Gram-negative bacilli are Bacteriology fragilis, Phasobacterium, Propanibacterium, and Prometric. Bacteriology fragilis is a very resistant species with biologically positive, and Prometric is almost the opposite of Bacteriology fragilis, which is biologically negative and a very resistant species. Again, Phasobacterium and Propomonas are two bacteria that show the fluorescence light under the UV that also grow in create a black color of a blood angle. But Phasobacterium have a spindle shape, cylindrical target tapered end. Phasobacterium is a vancomycin resistant, and Propanibacterium is a kanamycin resistant. This group is further explained in detail. If we see the catalase positive group is a Bacteriology, which is acetylcholine positive, and they are non-motile and grow in 20% bile. They cause the bacteremia, abscesses, and also beta-lactamase producer. The group which is closely related to the Bacteriology are Prometric, which is also very resistant species but negative to bile-acetylcholine, and they are oral flora and positive for indole. Another group is Propomonas. Propomonas is are resistant to kanamycin and dole positive, and brain abscesses, they are mostly found in the brain abscesses. Phasobacterium is a bacterium that causes a syndrome called the Lemierre syndrome, and also called the necrobacillosis, normally found in the oral, genital, and GIT. Resistant to vancomycin. Veillonella, as we explained, it's a gram-negative cocci. Parvola is found in the polymicrobial culture, like bind wound, head and neck infection. The only organism in anaerobic group that is a cocci and positive to nitrate. Phasobacterium is further explained in detail. There is a 4 species of a Phasobacterium: Phasobacterium mortiforum, Phasobacterium necrophorum, Phasobacterium neclotum, and Phasobacterium varium. Phasobacterium mortiforum and Phasobacterium varium both can grow on 20% bile, and Phasobacterium necrophorum and Phasobacterium neclotum both positive for indole. As you know that this whole group is resistant to the vancomycin. If we see the pigmenting species, the pigmenting species are Prometric and Propomonas, and both are indole positive. And as you know, the Prometric is resistant to all antibiotic in ID, but Propomonas is only sensitive to vancomycin, but it is resistant to colostine, but it is sensitive to penicillin. Veillonella, these two are the pigmented. Veillonella species is a non-pigmented species, and it's also resistant to the vancomycin and nitrate positive, as we earlier explained. If you see the anaerobic gram-positive cocci, if metronidazole disc 5 mg disc is very important to differentiate between the microphilic and anaerobes. Anaerobes are 15 mm, show the 15 mm zone, and microphilic are usually resistant. Pheniguloidea is a pair and cluster smooth non-hemolytic SPS resistant large cocci. These are equal to or greater than 0.6 micron meter. Another group in the gram-positive anaerobic cocci are Peptostreptococcus anaerobius, which is gray-white non-hemolytic SPS sensitive, and the zone is equal to or greater than 12 mm. Another bacteria in this group is Parvimonas micra or Microminas micra. It's a small cocci, and these are SPS resistant. If you see, the Parvimonas micra and Pheniguloidea can be confused with one another, but both are SPS resistant, but Pheniguloidea is larger in size as compared to the Parvimonas micra. Clostridium species. Clostridium is a gram-positive rod with boxer shape in spore-forming ability. It's an obligate anaerobes. The only species in this Clostridia is Clostridium difficile, which is non-hemolytic. All other species are beta hemolytic. Clostridium botulinum, novi, preferences, sodoli, tetani. All these species have some different characteristics, like tetani can swarm, and sodoli is positive for urea and indole, and preferences show the double zone of hemolysis. Novi is indole negative. There is no spores for preferences. So first we will discuss the preferences, which is non-motile and capable of producing enterotoxins, which cause the foodborne gastroenteritis, improperly cooked meat, diarrhea, abdominal cramps, 7 to 15 hours after ingestion. They produce the alpha toxins, which is also called the myonecrosis, gas gangrene. Clostridium preferentiae type C is a normal flora. Some strains produce the beta toxins, cause the necroticans. They cause the severe disease in the small bowel in children. On the gram stain, if we see, there is a three organisms like Clostridium novi, Clostridium septicum, and Clostridium histolyticum. They are able to produce the alpha toxins. Alpha toxins are basically the lecithinase production. If you see, all of these three lecithinase is positive, and that's why they have the ability to produce the alpha toxins. Swarming is another ability of this group, and that is because of phospholipase C. This bacteria sporulated 37 degrees centigrade and with the double hemolysis, which differentiated Clostridium preferentiae from all other Clostridia. Another group is Clostridium botulism. Clostridium botulinum is a flaccid paralysis. 7 different neurotoxin cause these flaccid paralysis. A, B, E, and F are the principal cause of the botulism. They cause the 4 type of botulism: foodborne botulism, ingestion preform toxin in the food; wound botulism; infant botulism in the children, toxin colonizing the intestinal tract; and botulism due to the colonization of intestine in adult. It's the oval subterminal spore with the GPR that cause the swelling of the cell, and also definitely beta hemolysis. Clostridium tetani is exotoxin producer, that is